opioid epidemic stretches across America. No state's been more affected than West Virginia, at almost 3 times the national average.
The number of deaths from opioid abuse continues to climb, topping 33,000 in 2015, according to the federal government. One of the hardest hit states is West Virginia.
We showed you remarkable pictures of people lining up down the block to collect painkillers at a doctor's office, an office the authorities say is really just a front for drug dealing.
There are certain companies that are guilty of spreading opioids in specific parts of the country where addiction has been the worst. So West Virginia is an example of that.
Fighting back against a deadly drug that is just crushing lives all across our area.
Which state has the highest death rate from drug overdoses? It's not even close. West Virginia.
The epidemic of prescription painkiller addiction. Ground zero is West Virginia, where doctors write 138 prescriptions for every 100 people. 7 doctors have lost.
What you're saying, the implication of what you're saying, that these big companies knew that they were pumping drugs into American communities that were killing people.
That's not an implication, that's a fact. That's exactly what they did.
In 2018, an award-winning study by the Charleston Gazette-Mail, a West Virginia newspaper, found that 2 pharmacies in the small town of Williamson, West Virginia, received shipments totaling nearly 20.8 million opioid painkillers from 2008 to 2015. The enormous shipments were delivered to the Tug Valley Pharmacy and the Hurley Drug Pharmacy. The pharmacies are suspiciously located only 4 blocks apart, and the town has a population of a mere 2,800 residents. Shipments of this size are not uncommon to West Virginia, the state most affected by the opioid crisis.
Oh, she's overdosed. Yeah, so we're trying to help. Can you breathe? Can you hear me, honey?
According to the National Institute on Drug Abuse, West Virginia has held the highest rate of opioid-related deaths since 1999, with deaths reaching a record high in 2017.
It's not even 10:30 in the morning in Huntington, West Virginia, and it's happened again. Another overdose, this time just outside a fast food restaurant. A woman is unconscious and turning blue on the sidewalk. First responders move in with an anti-overdose medication, naloxone. A few minutes pass, she revives, as if waking from a nap.
In addition to the high rates of addiction and overdose death, the Center for Disease Control and Prevention reports that as of March this year, West Virginia has seen an alarming increase in the amount of confirmed cases of hepatitis A. Scientific American has deemed the outbreak, quote, one of the largest reported hepatitis A outbreaks in U.S. history. Furthermore, the CDC reports that 80% of infected people say they use illegal drugs.
Timmy, oh, you've been doing heroin.
It's been a while since you've done it?
Done it, or you've been doing it for a while? Yeah.
In addition to this, the CDC also reports that West Virginia has the nation's highest rate of babies born dependent on drugs, a rate of 33.4 cases per 1,000 hospital births.
And now to our special 27 Investigates coverage, drugs in the Valley. Local health leaders say 10% of all babies in the Mahoning Valley are born to drug-addicted mothers. Now that's 600 babies every year at risk.
These babies are affected by the drugs that their mother took when they were pregnant. These babies have brain changes. It's not just a matter of getting this drug out of this baby's system. It is trying to teach them a new normal because their normal has always been with drugs.
Most addictions stem from maternal opioid use, which results in the child experiencing withdrawal symptoms. Opioid withdrawal is painful for adult drug addicts, causing diarrhea, vomiting, anxiety, and restlessness.
Now imagine that physical pain happening in a newborn baby.
They're jittery, they have tremors, they lose a lot of weight, they have loose, watery stools, they cry and cry and cry.
The damage has already been done. West Virginia has experienced an awful tragedy. The opioid crisis has taken thousands of innocent lives, broken up families, and disturbed a once peaceful Appalachia. As for what caused this crisis in the first place, a disturbing correlation exists between the number of written opioid prescriptions and the number of overdose deaths. In February 2018, Katie Metler reported in her piece for the Washington Post titled, "How Misleading Marketing Got America Addicted," that, quote, in 1997, doctors wrote 670,000 OxyContin prescriptions for non-cancer pain, and that, quote, in 2002, doctors wrote 6.2 million prescriptions. The CDC reports that during the same time period, from 1999 and beyond, opioid-related deaths have skyrocketed. In 1999, the death rate was 1.8 deaths per 100,000 people, and in 2016, a whopping 43.4 deaths per 100,000. What caused the increase in the death rate from 1999 to 2016? The answer? The pharmaceutical industry.
28 counties are fighting back with a lawsuit.
The counties blame big pharmaceutical companies for deceptive practices when it comes to long-term use of painkillers.
Prior to 1998, opioid painkillers were rarely prescribed to treat chronic pain. Besides life-threatening conditions such as cancer, opioid painkillers were considered to be too addictive for long-term use. That was until in the late 1990s when multiple pharmaceutical giants embarked on a multifaceted marketing campaign that targeted health professionals in order to persuade them to prescribe more frequently.
And people die every day in America from opioid drug overdoses. In an explosive joint investigation by 60 Minutes and the Washington Post, whistleblowers tell Bill Whitaker how the drug industry, with the help of Congress, turned an epidemic into a full-blown crisis.
Purdue Pharma played perhaps the most significant role. Purdue distributed over 15,000 copies of their OxyContin promotional video to doctors and other healthcare professionals in 1998 alone. Along with the video, Purdue included merchandise, including bucket hats, plush toys, and even a swing CD. The promotional video, titled "I Got My Life Back," featured emotional accounts of 7 OxyContin patients as they explained how much the painkiller had improved their lives.
I got my life back now. Now I can enjoy every day that I live. I can really enjoy myself. And before, even a good day was hell. I mean, I couldn't enjoy nothing, but now I can enjoy myself. That's when I say it's wonderful. I look at the future the same way a young guy, 25, 30-year-old would.
In 2016, the Organization of the Physicians for Responsible Opioid Prescribing released a documentary revealing that 15 years later, 2 of the 7 patients were active opioid abusers when they died, and a third had become addicted.
Since I've been on this new pain medication, I have not missed one day of work, and my boss really appreciates that, Lauren.
The video even featured outright false claims, such as,
"The rate of addiction amongst pain patients who are treated by doctors is much less than 1%.
This quote was taken from a 1-paragraph, non-peer-reviewed letter sent to the New England Journal of Medicine that had no studies or scientific evidence to back it up. This same letter was quoted by drug companies for years in order to support their claims about opioid safety.
Less than 1% of patients taking opioids actually become addicted.
Less than 1%. And I know it may seem like they are pulling that number out of their arse, but they actually pulled it out of the letters to the editor section of the New England Journal of Medicine. Seriously, this is it. That paragraph is the whole thing. It wasn't peer-reviewed, and it was only about short-term use of opioids in hospitals, but it became the main source for that 1% claim.
And Purdue is not the only company that played a role. Incest Therapeutics, another large pharmaceutical company, was reported to have influenced doctors by hiring attractive women to take them out to expensive dinners and convince them to join their speaker programs, in which doctors would be paid large sums of money to preach opioid safety and frequent prescriptions to other medical professionals.
There is a former executive at Incest Therapeutics is expected to plead guilty on Wednesday to charges that he participated in a scheme to bribe doctors to prescribe the company's opioid drug.
Even more disturbing, the Hastings Center of Bioethics Research analyzed a report by the U.S. Senate Homeland Security and Governmental Affairs Committee in April 2018 and found that, quote, 5 opioid manufacturers, Purdue, Janssen, DepotMed, Incess, and Mylan, contributed $9 million to 14 pain advocacy groups within 5 years, end quote, in order to promote pain awareness and effectively increase sales.
The medical community began to hear that we had been allowing patients to suffer needlessly because of an overblown fear of addiction, and that the compassionate way to treat just about any complaint of pain was with an opioid. As we responded to this campaign, as the prescribing went up, it led to a public health catastrophe.
And it paid off. Metler reports that in 1996, OxyContin sales were $44.8 million, and in 2002, $1.54 billion. Purdue was fined by the U.S. government in 2007 for $634.5 million, less than half of what they made in those same 6 years. As of 2017, Purdue's yearly earnings were over $35 billion. The Sackler family, the owners and founder of Purdue, are currently ranked as number 19 on the Forbes list of richest American families and valued at $13 billion.
In 2007, Purdue pled guilty to a felony charge of misleading regulators about OxyContin's potential for abuse and paid a fine of $600 million. You know you've been bad when the government fines you one aircraft carrier.
Today, opioid painkillers are prescribed much more frequently than in 1999. The influx of opioid painkillers into West Virginia from 1998 is to blame for much of the damage caused to the state. Everyday innocent people are affected and dying from this terrible epidemic. Children who were born to drug-addicted mothers, poverty-stricken Americans who turned down a wrong path, and painkiller patients who were unaware of the risks. It's important that we educate young adults on the dangers of not only street drugs, but also drugs for medical usage. Drexel University researchers performed a study in 2008 that interviewed urban opioid injection drug users. The study concluded that 75% of those interviewed were introduced with prescription opioids. However, education alone will not fix the crisis. We must look to alternative strategies to fight addiction. In 2016, President Trump declared the crisis a national emergency.
Today, my administration is officially declaring the opioid crisis a national public health emergency under federal law, and why I am directing all executive agencies to use every appropriate emergency authority to fight the opioid crisis.
Government efforts to reduce opioid prescriptions and fight drug-related crime have had little to no effect. Deaths are still rising. One small town, Dayton, Ohio, has seen promising results from their efforts to fight the epidemic. In 2017, Dayton had one of the highest rates of overdose in the country.
While fatal overdoses continue to rise nationwide, one city, Dayton, Ohio, has seen its numbers drop by 50% over the past year.
Dayton spent over $350,000 in naloxone last year and constructed brand new harm reduction centers, including needle exchanges and fentanyl testing sites. Dayton is also investing in facilities to provide housing for addicts who cannot afford it and funding associations that train recovered addicts to assist those current addicts in need. Since then, Dayton has seen a 54% decline in overdose deaths so far in 2018. These results are very hopeful, as most efforts to stop the crisis have proven effortless. Drastic measures must be taken in order to restore West Virginia and save the lives of thousands of adults and their children.
Realize heroin addiction, the epidemic that it is. In Hennepin County alone, just last year, 50 people died of heroin overdose. One was my son. In school and all that, did I ever think that that's my son's gonna grow up to be a heroin addict? Did he ever think that?
My husband called me on the phone and he said, our son has died. Word had gotten out with a lot of our friends and family about his drug use. And I had a friend come up to me at the gym and started talking a lot about death and drug addicts dying, and it just turned. And I remembered feeling gripped with anxiety.
What the drug industry did to West Virginia is criminal. Drug companies have murdered thousands of innocent people. It's time for change.